Hi, my name's Sam Treadway and I'm a clinical scientist at the Functional Gut Clinic. And in today's talk, I'm going to speak about how changes in the microbiome, the gut bacteria, can potentially lead to troublesome abdominal symptoms. I'm then going to go on to talk about how a test called hydrogen methane breath testing can help detect these imbalances in the gut bacteria, and where breath testing fits into the diagnostic pathway, the patient journey, when and where you would expect to have a breath test if you were experiencing these abdominal symptoms. The gastrointestinal tract is a two-pronged system we use to extract nutrients from the food and drink we ingest. It starts at the mouth and finishes at the anus. And this two-pronged system is, of course, mechanical and chemical digestion that our own body performs, but also the process of fermentation performed by the gut bacteria. The gastrointestinal tract is around 30 foot long, and to put that into perspective, that's longer than a double-decker bus. Our intestinal tract can be split simply into two sections, the small intestine and the large intestine or colon. The small intestine is responsible for the absorption of our dietary nutrients that we ingest, and the colon reabsorbs water, but it's mostly for the storing and excretion of stool from our body. The colon is home to the majority of our gut bacteria, with bacterial numbers greater than 100 billion colony-forming units per milliliter. These bacteria in our colon live off the food that we don't digest very well, like fibre and certain carbohydrates. They break down these carbohydrates through the process of fermentation, which produces gases, water, short-chain fatty acids, as well as other byproducts. Although the colon can accommodate high concentrations of bacteria, if this community becomes imbalanced, the host may experience unpleasant abdominal symptoms. To the contrary, there is a vastly smaller concentration of bacteria in the small intestine of a healthy GI tract, with around 1,000 colony-forming units per milliliter. If there's more than 1,000 colony-forming units per milliliter in the jejunum, which is the mid part of the small intestine, this can be considered a small intestinal bacterial overgrowth. Now, the problem with high concentrations of bacteria in the small intestine is that they can ferment easily digestible carbohydrates before our body digests them, and also ferment poorly digestible carbohydrates in the small bowel, where this would normally take place in the colon. This is problematic because the small bowel is much more sensitive and ill-equipped to deal with the waste products of fermentation, and therefore someone may experience symptoms if this is occurring. If we look at the diagram on the screen, the top image represents the normal distribution of bacteria from the duodenum to the colon, whereas the bottom image demonstrates the distribution of bacteria in small intestinal bacterial overgrowth. When we have a healthy distribution of bacteria in the small intestine, easily digestible carbohydrates are mainly broken down, digested and absorbed in the jejunum, duodenum and proximal ileum. As you can see in the picture of small intestinal bacterial overgrowth, these easily digestible sugars start to be fermented much further up the intestinal tract in the jejunum and proximal ileum. You will also see in the picture of small intestinal bacterial overgrowth that poorly digestible starches that are normally broken down or fermented in the colon start to be fermented much higher up the gastrointestinal tract. The issue with excessive fermentation in the small bowel is it can lead to symptoms. Most commonly symptoms such as abdominal pain, bloating, a change in bowel habit, which is predominantly diarrhea in those with excessive hydrogen gas production in the small bowel. Symptoms of flatulence, belching. There's also been linked with extra gastrointestinal symptoms such as skin issues like rosacea, and in severe cases of SIBO, the patient may become malnourished because the bacteria in the small bowel are fermenting the nutrients that we ingest instead of it being broken down and absorbed, so it can cause nutrient deficiencies. Now, you're probably wondering what causes SIBO, and in many patients it can be very difficult to pinpoint the exact cause of their bacterial overgrowth. However, there are certainly risk factors that can predispose people to developing this condition, and perhaps one of the most common causes of SIBO and gut dysbiosis in general is the use or overuse of antibiotics. Now, antibiotics, especially the broad spectrum varieties, can wipe out the gut flora, causing an imbalance in microorganisms once the gut starts to be repopulated. Likewise, food poisoning and gut infections can cause dysbiosis through the overgrowth of certain pathogens. Another link has been made between decreased stomach acidity and small intestinal bacterial overgrowth. Our stomachs acts like a disinfectant. It's an acid bath that stops bacteria from the upper tract, from our mouth down through to our stomach, entering the small intestine. Now, if this acid bath, this mechanism is compromised, and the acidity becomes more neutralized, such as when someone takes proton pump inhibitors for acid reflux, or if they have hypochlorhydria, which simply means a decrease in acidity of the stomach, or even drinking alkaline water. These are going to remove or decrease this acid barrier and allow these bacteria to pass through the stomach into the small intestine and potentially proliferate. There's also been many links made between certain health conditions and the development of SIBO, and particularly those that affect the motility of the small bowel. This can be seen in such conditions like diabetes, which affects the nerve supply in the small bowel, or in scleroderma, which affects the lining of the smooth muscle of the small intestine, and therefore, in both cases, the contents of the small bowel can become stagnated, and this allows bacteria to really proliferate without being cleared from the small intestine. I touched on the fact that an imbalance in colonic microorganisms can also cause symptoms, and there are thousands of different species of microorganisms in the colon, and we're far from knowing what the perfect balance is, if there is one, and how all these microorganisms interact. However, studies have shown that increased methane production in the large intestine is associated with a slowing of intestinal motility, or a more constipation type picture. So potentially, if a person is identified as having too much methane and has constipation, there is a potential pathway to try and rebalance that colonic microflora to relieve symptoms. We can diagnose excessive methane production or small intestinal bacterial overgrowth using a simple non-invasive test called a hydrogen and methane breath test. And this test can also be used to diagnose whether someone isn't breaking down certain carbohydrates as they should, and if these carbohydrates are therefore being excessively fermented in the colon. In the second half of this talk, I'm going to be discussing how breath testing fits into the diagnostic pathway and the science behind breath testing. Now, there are many routes whereby a patient may end up having a hydrogen and methane breath test, but I'm going to touch about probably the most common route they derive for this test. So they'd likely be referred to a gastroenterologist following some conservative management from the GP, which may not have worked, or for a second opinion, and they'd probably be referred because of symptoms of abdominal pain, bloating, dissatisfaction with bowel habit, gassy type symptoms, your typical IBS type symptoms. Now, the GP probably would have already done this, but the gastroenterologist will certainly exclude any red flag symptoms, any symptoms deemed sort of dangerous, which may be an indication of something more sinister, such as weight loss, a sudden change in bowel habit, rectal bleeding. And if any of these symptoms were present, or if there's sort of any suspicion that something more sinister might be going on, the patient would certainly be referred for some imaging, or something like a colonoscopy, a camera, to have a look at the gastrointestinal tract. If there are no red flag symptoms, or if all the sort of other investigations are negative, the gastroenterologist would probably undertake some conservative management of the patient's symptoms. So they may refer them for some dietetic advice, so to visit a dietitian to discuss their diet and how they can change their diet to reduce symptoms. Lifestyle advice, such as reducing stress, alcohol, weight loss, which may help reduce symptoms, and also a review of their medication and a trial maybe of some new medication, such as a low-dose antidepressant, which may help reduce gut sensitivity. If these conservative measures work, so symptoms are not persisting or well managed, the patient will likely continue with these. However, if the symptoms do persist, they may then be referred for tertiary sort of testing, so further testing, and this is where they would undergo a breath test for small intestinal bacterial overgrowth or perhaps carbohydrate malabsorption. So I'll briefly talk you through the science behind hydrogen and methane breath testing. So we actually utilise the gases produced in fermentation to determine whether SIBO or excessive methane production is occurring. Hydrogen and methane are both gases produced by the bacteria in our gut, but not by our own cells, and therefore we can be confident by measuring these gases in our breath that we are indirectly measuring fermentation. And when fermentation occurs, these gases traverse the intestinal epithelium and are absorbed into the blood and finally excreted via the lungs in our breath. In preparation for hydrogen and methane breath testing, we ask that patients follow a highly restrictive, low fermentable diet on the day prior to the test and also fast for 12 hours before the baseline breath sample. This ensures little or no fermentation is occurring at the baseline sample to improve the quality of the results and give a clear diagnosis. Following the first or baseline breath sample, the patient ingests a solution of lactulose or glucose, and the breath samples are then taken every 15 minutes for the next 2 hours. A positive or negative result for SIBO is determined by the amount and timing of hydrogen gas production, and symptoms are also monitored to validate the association of gas production with the patient's symptoms. As a SIBO breath test can last between 2 and 3 hours, they're quite obviously time consuming. The test can be done at home easily with a postal breath test kit, which is simply shipped to the patient with instructions on how to perform the test and then shipped back following completion. A positive result for SIBO is a rise of more than 10 parts per million of hydrogen within 60 minutes by European guidelines, or a rise of more than 20 parts per million of hydrogen within 90 minutes by North American consensus guidelines. If you can see the graph at the top right of the slide, this represents a positive result. So there's a rise of more than 10 parts per million at 60 minutes, represented by the blue line, and a rise of more than 20 parts per million within 90 minutes, so a clear positive result for SIBO. And there's also a rise in symptoms associated with the rise in gases, which would validate that this is a positive study. At the bottom right corner of the screen, you'll see a negative result for a SIBO lactulose trace. So there's no significant rise within 60 or 90 minutes of hydrogen. There is a slight rise at the end of the study, which is the lactulose arriving in the colon, which is perfectly normal. A positive result for methane, which is represented by the graph at the bottom left of the slide, is slightly different. We'll look at this in a slightly different way. If methane is higher than 10 parts per million at any point in the study, this is considered excessive methane production. And this can be in the small bowel or the colon. Therefore, we call this intestinal methanogen overgrowth, and it's not classified as SIBO. So once the results of the tests have been reported, they'll be sent back to the referring consultant, who will then, if positive, will treat the SIBO. And the mainstay treatment for SIBO is a course of antibiotics. Now, doctors use a range of different antibiotics to treat SIBO, but the most well-researched is the antibiotic rifaximin. And this is a really nice antibiotic for treating SIBO because it works specifically on the lumen of the gut and is not absorbed into the bloodstream. And because it has poor absorption, this means it has little side effects compared to other antibiotics. It also works most effectively in the presence of bile acid, which is produced in the small bowel. So this means rifaximin's effects on the colonic flora are limited. More conservatively, a doctor may choose to treat the symptoms of SIBO with dietary management. One diet that is commonly used in the treatment of symptoms of small intestinal bacterial overgrowth is the FODMAP diet. Now, the FODMAP diet is a reduction in foods which contain highly fermentable sugars and sugar alcohols. So by reducing these foods, there's less substrate for these bacteria in the small bowel to ferment, which essentially starves the bacteria, and also reduces the amount of waste products due to fermentation, and therefore reduces symptoms associated with SIBO. If the SIBO test is negative, or if there is a specific food or food group which tends to be causing symptoms, the referring doctor or dietitian may want to perform a carbohydrate malabsorption test to determine whether a specific sugar could be causing the patient's symptoms. Now, carbohydrate malabsorption is where a certain sugar is not digested properly in the GI tract and therefore is fermented and can cause upsetting symptoms, specifically abdominal pain, gassy symptoms, and diarrhea. The most common example of this is lactose intolerance. Lactose is the sugar found in dairy products, and as a child, most of us produce the enzyme lactase to digest lactose in breast milk, but as we get older, some of us lose the ability to produce this enzyme. This is very common in African and Asian populations. When lactase isn't produced, lactose, the sugar, cannot be broken down, and therefore it arrives in the colon where it's fermented and causes these symptoms. Other sugars we can test for include fructose, the sugar found in fruit, and sugar alcohols like sorbitol, mannitol, xylitol, which are mostly used as sweeteners. The test is performed in the same way as the SIBO test, but instead of using glucose or lactulose, we use the specific sugar as the substrate that we are aiming to interrogate. If a carbohydrate malabsorption test is positive, then the sugar tested can simply be reduced or omitted from the patient's diet. So just to summarise that talk, changes or imbalance in our gut bacteria, our microbiome, can lead to debilitating abdominal symptoms. Two common causes of these symptoms are small intestinal bacterial overgrowth or intestinal methane overgrowth, and these are common in those who experience IBS type symptoms. We can test for these imbalances using breath testing, which is a non-invasive way of diagnosing these conditions that can be done in the comfort of the patient's own home. It's important to use these tests as part of a multidisciplinary treatment pathway, so working with dietitians and doctors in order to diagnose and treat these conditions. And there's also a large number of the population that can't digest certain sugars, and breath testing can also be used to detect whether a person is malabsorbing certain sugars, and then they can be omitted or reduced in the diet in order to reduce symptoms.